Hi, my name is Kathleen and I wrote this book, Loving Choices, Peaceful Passing, Why My Family Chose Hospice. And today I want to talk about some of the difficulties of talking about hospice care with physicians. When my dad was diagnosed with non-Hodgkin's lymphoma, he was given 4 weeks to live without treatment. After the 3rd week of radiation, my dad was sent from the oncology clinic to the hospital in an ambulance because he was too weak to keep taking the treatments. When I went into his hospital room that night, I knew my dad was dying. I had been manager of the health insurance counseling and advocacy program, and I knew the Medicare hospice benefit well. But even with that knowledge, I couldn't bring myself to broach the topic of hospice with my father. The next morning, I called Dr. Archer's office to talk about Dad's condition. Dr. Archer said Dad would need a stomach tube to continue the radiation treatments. And I told him that my dad was miserable, he was bedridden, the quality of his life was 0. And he had told me on more than one occasion that he didn't want to live like this anymore. And Dr. Archer came back with the statement about the stomach tube to continue treatment. So I worked up my courage and I said, "We think it might be time for hospice." And Dr. Archer said, "At this point, that's a good thing to consider. It's best when the family decides." So I asked him to help us talk to Dad because none of us knew what to say. And he said, "Doesn't your dad know he's dying?" And I was really taken aback because Dr. Archer obviously knew Dad was dying, but he didn't want to bring up hospice care until a member of the family, me, brought it up. Well, he came to the hospital at 5 p.m. that evening, and in the most kind and compassionate way, told my dad that he considered guys like him terminal. It was from that moment on that we focused on the rest of my dad's life. My sister and I took him back to the apartment he lived in with my mom in a retirement community. The hospice personnel helped us keep him comfortable. He was very, very happy to be home. And he passed peacefully in his sleep 29 days later. In 2016, a survey was done of physicians in all 50 states about the topic of end-of-life care discussions. 3/4 of physicians believe it's their responsibility to bring up end-of-life discussions with patients and families, but 2/3 cite the lack of time as a barrier to those discussions. And 60% of physicians say that they don't bring up hospice care because they're not really sure it's time. In order to enter hospice, you have to be determined by the physician to have 6 months or less to live. And that's a very difficult prediction for anyone to make, even a doctor who knows his patient well. So I certainly understand the dilemmas that doctors face when it comes to these discussions. I recently read a really beautiful book by Atul Gawande called Being Mortal, and I want to read a little excerpt from it when he was taking care of his father when his father was near the end of his life. And he says, "If to be human is to be limited, then the role of caring professions and institutions, from surgeons to nursing homes, ought to be aiding people in their struggle with those limits. Sometimes we can offer a cure, sometimes only a salve, sometimes not even that. But whatever we can offer, our interventions and the risks and sacrifices they entail are justified only if they serve the larger aims of a person's life. When we forget that, the suffering we inflict can be barbaric. When we remember it, the good we can do is breathtaking." I never expected that among the most meaningful experiences I'd have as a doctor, and really as a human being, would come from helping others deal with what medicine cannot do as well as what it can. But it's proved true, whether with a patient, a friend, or someone I loved as much as my father. My father came to his end never having to sacrifice his loyalties or who he was, and for that, I am grateful. Again, the book is Loving Choices, Peaceful Passing, Why My Family Chose Hospice. You can buy it anywhere online where books are sold, and if you live in the Los Angeles metropolitan area, you can pick up a copy at Vroman's bookstore. I hope you'll give it a read.